A mysterious killer, the unknown disease in Congo. A mysterious disease is spreading terror in the Equateur province of the Democratic Republic of Congo, claiming lives at an alarming pace. 53 lives have already been lost in just days, leaving an unsettling question. What is causing this deadly illness? With over 430 cases reported so far, victims succumb to symptoms like fever, vomiting, diarrhea, and shocking hemorrhagic episodes within a mere 48 hours. Imagine a world where an unidentified illness could strike unpredictably, devastating families and communities almost overnight. This is the reality Congo faces. The outbreak began in 2 isolated villages, places most of us have never heard of, yet are now at the heart of international attention. What triggered this catastrophe? Experts suspect contaminated bat consumption, linking the crisis to ancient dietary customs. But how did it spread so rapidly? The lack of immediate medical care and proper facilities turned this remote outbreak into a silent disaster. These villages, fragile under the weight of poverty and inadequate infrastructure, faced the storm head-on without preparation. Initial fears pointed fingers at familiar killers like Ebola or Marburg virus, both known for their devastating effects. Yet lab tests ruled out these culprits, labeling the terrorist within as unknown. For health authorities, this creates not only a medical, but a scientific dilemma. What makes this disease even more frightening is the complete lack of answers. Until we can name it, treat it, or contain it, the situation remains a deadly guessing game. Imagine fighting an unknown enemy with limited weapons, a nightmare unfolding in real life. The remote Equateur region was struggling even before this outbreak. Weak healthcare infrastructure, minimal access to error-proof diagnostic tools, and fragile supply chains have left this community vulnerable. In moments of crisis, such weaknesses become life-threatening. Add the tension of political instability, and the scene becomes even graver. Roads are crumbling, clinics are overburdened, and locals are left to fend for themselves. The race against time to curb infections seems more overwhelming than ever. Families in the affected areas are torn as loved ones succumb to the illness one after another. The fear of touching, helping, or even mourning has paralyzed these communities. Cultural traditions clash with survival instincts. A mother hesitates to embrace her sick child. Meanwhile, neighboring villages close their doors, terrified of the disease encroaching. Social bonds disintegrate, and everyday life is swallowed by uncertainty and grief. This outbreak doesn't just target human bodies, it crushes hope and community. An outbreak like this reminds us that what happens in one part of the world affects us all. This disease, as of now, has stayed within Equateur province. But how far are we from crossing borders? Global action must begin before it's too late. We live in an interconnected world where local diseases can turn into global pandemics. Congo's crisis could become a nightmare for humanity, especially when no vaccine, cure, or clear defense exists. This isn't just Congo's challenge, it's the world's problem to solve. Experts are calling for urgent steps, including sending rapid response teams, setting up temporary healthcare facilities, and conducting advanced research to identify the disease. These are the steps that could bring some relief to the suffering communities and perhaps save countless lives globally. There's also a need for education campaigns to empower locals with knowledge about prevention, such as safer food sourcing, hygiene, and how to handle early symptoms. Preparedness starts with understanding and action from within, while the world steps in to provide resources. If this outbreak teaches us one thing, it's how fragile human health systems can be. It's a warning to re-evaluate our preparedness against sudden, unknown diseases. Let's not wait for another Equateur-like disaster before we take global health initiatives seriously. Strengthening infrastructures in remote regions, improving response mechanisms, and prioritizing disease surveillance are critical next steps. Without them, we leave the door open to future outbreaks, more devastating and far-reaching than even this one. The people of Congo need urgent global support, from advocacy to funding life-saving interventions. Watch this story, share it, and amplify the call for international aid. Together, we can help stop the spread of this deadly disease and create a safer future. Let this disaster serve as a call to action for everybody. Support global health initiatives, donate to credible organizations, and push governments to act now. The fight against this unknown disease begins now, with all of us as part of the solution.